Did you know that you can use Botox to lift the eyebrows?
Botox is just placed in the forehead. It'll drop the eyebrows.
Botox can lift the brows. It definitely can lower the brows. So what is it? Is Botox gonna lift the brows or it's gonna lower the brows? This is a very confusing situation. Let's figure it out. Hi, this is Dr. Konstantin. I'm a facial plastic surgeon and a facelift expert. And we're talking today about Botox and specifically about how Botox is going to change the position of your brows. And a lot of people are very confused by that because they've heard that Botox can lift the brows, they go get their injections done, and it turns out that Botox actually drops their brows. And now they're looking at their eyes being hooded and the brows are in this very low position and they're very upset about that. So what to expect and what's actually going to happen to you when you're going to get your Botox injection? The answer is it depends on what areas are injected. So the frontalis is the muscle that goes across the entire forehead, and this is the muscle that we inject to get rid of those wrinkles right above the brows, those horizontal lines. And if the whole muscle is injected and it's completely paralyzed, you can see how it will have the effect of dropping your brows, right? So if the muscle that actually helps to lift the brows, like if you are surprised, if we paralyze that muscle, then the brows are gonna come down. Now, we don't have to inject the whole muscle, or not always we have to inject the whole muscle. So oftentimes we can inject just the central portion of the muscle and leave some segments of the muscle intact. And in that situation, that segment of the muscle that we didn't put Botox into is actually going to lift the brows. And typically it happens around the corner of the brows. That corner is getting elevated and the brow right here at the center is in its normal position. Now, one downside of lifting the brows this way is that when the brow is lifted, it changes the shape of the brow a little bit. And this is a very infamous brow type or brow position that we see on some celebrities when they have a bit of an angle here. So the brow is elevated, but it's not nice and curved, it just comes at an angle here. And that's something that a lot of times people say, oh, that's just Botox and it's not very well done Botox and we don't like it. So this very distinct look is something that we want to stay away from. Now, how do we lift the brows and staying away from that kind of look? Well, we do have to do a very measured injection. So we make the muscle a little weaker, but not paralyze it completely. And we also work with the muscles that pull the brow down, right? So the frontalis muscle that we talked about is going to elevate the brows, but there are other muscles that actually pull the brow down, and those are the muscles that make you frown, for example. And you can see, you can practice that in front of the mirror. You can, when you frown, you see your brows going in and down, and when you smile or when you squint, the corners of the brow is going to come down. So by putting Botox in those muscles, we're going to help to elevate it. And by putting Botox into the central portion of the forehead or the central portion of frontalis muscle, we're going to lift the side of the brow. When all put together, you should have a nice lifting effect. Although, you know, it's not the kind of lift that would be achieved with surgery, but it could be fairly substantial. The brow typically looks very natural. You don't have that very distinct Botox brow that people typically frown on. If you guys have any questions, please ask them below and I'll be happy to make a future video based on your questions.